Hi, everyone. Thank you so much for joining us today. We're really excited to have you all on the call for what we're sure is going to be a really informative and exciting webinar. We'd love to talk to you today about our recent research, medical appliances for resource-constrained settings. And we've also been joined here today by a couple of great panelists, including Justice Segundo and Dr. Carlin Senyodo. And so we are really excited to get kicked off here. I'll turn it over to the SE for All team first for a few remarks. Thank you. I think over to Harriet as well at the Carbon Trust. Thank you, Harriet. Could you please start us off with some opening remarks? Harriet
Sure,
Bradshaw
thank you.
Smith from the Carbon Trust. Thank you.
Great, thanks. Thanks, Sienna. Hi, everyone. I'm Harriet Bradshaw Smith. I lead the Leave No One Behind portfolio within the Transforming Energy Access platform, which the Carbon Trust manages on behalf of the Foreign and Commonwealth and Development Office. Firstly, I'd like to thank SE for All and CLAS research team who produced this report. I think it's a great piece of work that ties in the technicality of monitoring energy efficiency with actionable recommendations. It is a significant report for the health facility electrification sector. It's one of the first or few studies that systematically looks at the energy efficiency, performance, and suitability of medical appliances. Data is critical for donor decision-making, and this report is a vital resource for donors and implementers as its recommendations are backed by evidence and data. A strength of this report is its diversification of medical appliances that have been studied. Most available data focuses on vaccine cold chain devices. However, medical services require a range of devices to deliver quality healthcare. We are in a moment of reducing ODA funding without the need declining. And partnerships and collaborations between donors, the private and public sectors, and cross-sector has never been more important. I really urge you all to absorb and use the recommendations from the report and work together to ensure that we continue to reduce and to one day eradicate the health facility electrification gap so every single person has access to quality healthcare. I hope you all enjoy the discussion today. Thank you, and back to you, Sienna.
Thank you so much, Harriet. Really appreciate you setting the scene for us there, and again, for you and Carbon Trust support. I'd like to just cover a few housekeeping rules. One, we will have a Q&A period following the presentation, but until then, please keep yourself on mute. I think that the chat section might be available later on, so please share your questions in the comment section or keep them for yourself until we are ready for the Q&A portion. These slides will also be shared over email, and we are happy to have additional follow-up. Any of us panelists or moderators are happy to answer any additional questions or feedback you might have later on over email as well. With that, next slide, please. I'd love to turn it over to Maria Elena from Sustainable Energy for All for a bit more background and about who we are.
Welcome, everyone, to our webinar. So, CLASP and SE for All decided to join forces and produce this report. So, brief introduction of who we are. CLASP is an international NGO leading in the development of the appliance market as a means to fight climate change and improve people's lives. CLASP is part of the Efficiency for Access Coalition. SE for All is an independent organization hosted by UNOPS. We're working at the intersection of energy, climate, and development, pushing towards an energy transition that leaves no one behind. So why did we decide to do this work? Both SE for All and CLASP have been investigating in this space with regards to health electrification and medical appliances, and work has showed that medical equipment, they still present technical and commercial challenges for patients, for health providers, but also initiative planners and decision makers. So the sector needs more data on efficiency, on best practices, and innovations. So we decided to join forces to produce for the first time a report that bases on real-time data, real data from remote clinics in rural Kenya, and specifically in the Kisumu County. So we did site visits, we did extensive data logging of particularly infant warmers, oxygen concentrators, and autoclaves. And what is our starting point? So previous work has shown that there's almost 100,000 facilities that lack reliable power. The majority has an unstable connection to the grid and uses or doesn't have any backup system. But usually if they have a backup system, that's a diesel generator. And there's also 25,000 facilities that have no power at all. So for the remote health facilities and the rural health facilities that are likely to have some power supply, the research has found that up to 70% of medical equipment remains unused due to technical complexities in maintaining and operating this and repairing, due to power supply issues, due to bad donation practices and lack of regulations. So this webinar, together with an event that we organized in Kisumu last week, are efforts to reverse the situation. So we're looking forward to today's discussion. Thank you very much. Back to you, Sienna.
Great. Thank you so much, Marilena, for that really helpful scene setting. Now I'd like to turn it over to Emily Bolo and Concepto Juan, two colleagues representing both CLASP and SE for All, who played a major role in developing this research and report. They're going to share some more insights from our recent work. Over to you, Emily, and on to the next slide, please.
Hi, good morning, good afternoon, depending on where you're joining us from. My name is Concepta. I'll jump in first, then I'll pass it over to Emily. So thank you so much for setting up the scene. And the study that we did, we covered 29 healthcare facilities in Kisumu County in Kenya. And I quickly ran through a few slides on some of the findings during our study before I hand it over to Emily. We see many healthcare facilities connected to some kind of electrical grid or mini grid, but the reliability of that power is not to the bar, which of course has very negative impacts on health service delivery. My colleagues have already laid a strong foundation, so I'll straight move into outlining the challenges we observed in the health facilities we visited. Challenges that are in many ways representative of what most of the facilities in resource-constrained settings globally continue to face. I'll start with the frequent power outage as one of the challenges we really observed during our visit. One of the biggest challenges in healthcare facilities in resource-constrained areas face is a frequent power outage. Almost half of the facilities we visited experienced blackouts every week. And in more than half of those cases, the outage lasts for over 7 hours. Imagine what that means for a hospital. That means surgeries are being interrupted, maybe maternity wards are left in the dark, and the vaccine spoiling in storage. In rural facilities, the situation is even worse. Some of the doctors or even nurses are forced to cancel or postpone life-saving procedures simply because there's no power. Mothers in labor may also be referred to distance hospitals, as we saw also in most of the healthcare facilities, and patients that might also risk losing their lives. Um, in some of these healthcare facilities, the problem is actually very extreme. Power is unavailable for nearly half of the day. While backup generators exist, they are also expensive to run and poorly maintained. So this leaves staffs with rationing power. They have to choose which specific machines to use and when, and also on relying on manual methods. Maybe you move to the next slide, please. Thank you. Uh, Another challenge that we really observed was on polluting backup solution. Our study found out that diesel generators remain the predominant form of power backup in health facilities, with almost half of them relying on these polluting and also costly solutions. So while generators offer temporary lifeline during outages, they also emit large amount of greenhouse gases that are very harmful um, pollutants, contributing to climate change and also worsening air quality for the surrounding environment. So the operation is also expensive due to the rising fuel costs and logistically challenges of supply, especially in remote areas. Even more concerning, some of the healthcare facilities we surveyed, they lacked any form of power backup, as you can see from the graph. and this leaves them with completely vulnerable during the power outages. In such cases, most of the healthcare workers are being forced to riskily coping mechanisms, such as also transferring patients, or rather postponing or canceling, as I've said before. And maybe we can go to the next slide. Okay, when you look at the manufacturer's rated power and also the tested power consumption, when we look at energy use in healthcare facilities, one of the big realities is that the actual power of the appliances rarely match what the manufacturers claim. In most of the healthcare facilities we visited, appliances consume either more or sometimes even less than the rated values. This also raises the concern about the reliability of the equipment and its compatibility with the energy system we design. On average, the power drawn by appliances during the testing was consistently above or rather below the manufacturer rating, as you can see from the graph. There are some that are above, and there are also some that are really below the rated power. For instance, when we tested two different infant formers, the same brand, both recorded higher consumption levels than what is indicated in their labels. The difference between the rated power and actual power consumption range as much as 45% below or even 56 above the stated value. So I'll pass to my colleague to carry on, and there's also discuss some of the recommendation opportunities from the study. Thank you. To you, Amy.
Thank you so much, Concepta, for setting the scene. So I'll continue from where you have stopped. And so this slide, we talk about the availability of medical appliances. And as been said, we surveyed 29 facilities in Kisumu, across Kisumu. And our main appliance of focus, we focused on 3 appliances, the infant warmers, the autoclaves, and the oxygen concentrators. In as much as most of these facilities had these appliances, they were not used effectively as they should. And in some facilities, mostly those that were around outside the Kisumu Center, Kisumu City, within a central business district, some equipments like the oxygen concentrators were entirely not used and were kept in storage, attributed to the issue of power fluctuation. So they resorted to other alternatives like the gas, the cylinders instead of the oxygen concentrator that often relies on power. Next slide. Yes, so some of the issues that are associated with lack or not these appliances not being as often as they should has to do with their suitability in energy constrained settings. And some of the issues that we identified, apart from the power instability, were the aspects of high energy use. For example, appliances like the autoclave, they consume high energy, and so this appliance was rarely used in most of these facilities, and facilities had to wait till they have a certain number of materials before they sterilize, just to minimize the energy consumption from these appliances. And also other factors that contribute to unsuitability of these appliances were issues to do with the spare parts and availability. Many of the parts of these appliances were broken and they could not easily access these spare parts locally. And so these appliances had to remain unused for long durations of time. And also the fact that most of these appliances, where they are donated, they don't come with user manuals, so the technicians find it difficult to maintain or even repair the damage that this appliance may have experienced. So these are some of the issues that are attributing to these appliances not being contextually fit for African context or in context that we have unreliable power. Moving on to the next slide. Yes, so from this slide we have, if I can see clearly, yes, we have energy and power consumption of appliances. And so we have appliances that consume high energy, while others, like the oxygen concentrators, their energy performance is not that high. But because these appliances are used for extended periods of time, they end up using a higher energy consumption overall compared to appliances like autoclave that consume high power, but they are rarely used to minimize or to manage the expenses that come from having to use these appliances often. So they are used like facilities hold, or can I say, are careful of how they use these appliances to minimize the operational cost, which was raised as a major concern for these facilities because their budget is somehow limited and can't cater to pay for these expenses that are attributed to high energy consumption of these appliances. So from our study, the oxygen concentrator was the most frequently, not most frequently, but an appliance that was used for extended duration, with the infant warmer being an appliance that was used frequently, probably because of the role that it plays in infant care. The next slide, please. Okay, the sector trends. Okay, so I'll go to the sector trends. Some of the sector trends we identified from the study was the rise of portable equipments in the market, with appliances like Delph Light, manufactured by Delph Imaging, which are portable and can be used at the point of care, and also appliances like Vaxibox, that is manufactured by Drop Access, and which are used even in remote areas because they have a battery backup that can run for up to or even more than 8 hours, making sure that patients receive care where they need them, regardless of whether there is power or not. We also have advances in AI and Internet of Things. And so these advances are crucial for these appliances because they enable data interpretation and also, they enable data interpretation, and also they enable real-time monitoring of data and making service and care to become more efficient, and so that our patient can get the services they need and get their results within a short period of time. Yes, I'll go to the next slide. Yes, so we have a few recommendations for governments, for health practitioners, and for donors. So the main recommendation for governments is to develop frameworks that create an enabling environment for our manufacturers, and also they need to establish maps and quality standards, because in the absence of these frameworks, it becomes difficult to standardize or even benchmark appliances that are fit for our settings. So there's need for these regulations to be put in place to facilitate or create an enabling environment, and also to make sure that the local manufacturers get the local incentives to procure or to manufacture these appliances without having obstacles that they often experience from our governments. And also from our health planners, we found out that most of the time their planning or even their procurement is not informed by energy, but they just use the general requirements. So a need exists to ensure that our procurement managers prioritize energy efficient appliances in their procurement and planning. Yes, so when I talk about manufacturing, they need to design energy efficient appliances and to encourage or even to create a stable environment that encourages the same. To the opportunities and next step, I will want to emphasize on collaboration. Collaboration is key. No entity operates or exists in a vacuum, so we need to collaborate with different partners to make sure that the appliances that we need, we manufacture or even procure appliances that are designed for our context, and also to ensure that we avoid duplication. That was a common phenomenon that we experienced while in our visit in Kisumu, because our companies or organizations tend to duplicate the same efforts, and which is costly in the long run. And so they need to make sure that we collaborate and maximize on the benefits that we can get from these appliances. So, and also there was a need to engage the Kisumu people, and we did when you bring these people together to learn from or even benchmark from what other facilities are doing, it's a way of encouraging progress. And from our meeting, we were there last week, and all the facilities that were there were impressed by the model that was at one facility that had adopted a solar PV with battery backup. And because of this facility had minimal expenses on electricity, and also all the appliances never experienced the damages that are attributed to unreliable or intermittent electricity. So the The facilities were encouraged and they are motivated to benchmark and adopt this model to ensure that their OPEX cost is reduced and also that the appliances remain functional for a long time. I'll stop for there because I believe my time is over as we proceed to the next steps. Thank you.
Great. Thank you so much, Emily and Concepta, for that really wonderful overview of the research. Next, I'd like to move to the next slide, please. Great, thank you. I'd like to invite Dr. Karlijns, who is the co-director of the Inclusive Global Health Lab at TU Delft and the co-founder of Chloe Innovations, to please walk us through some exciting remarks he has prepared. Dr. Karlijns, over to you. Thank you.
Thank you, Shana. Pleasure to be here. Greetings, everyone. And we'll be having a short chat with you all on the topic of medical appliances. And I will speak from a perspective of medical device, its design, innovation, and how we implement them in resource-conscious areas. And my background is in industrial engineering and design, and so I'll focus on how we, our approach to how we develop medical devices that will suit, resource-conscious settings and also energy efficient. Next slide, please. And so just a background, right, on how we develop medical devices. Medical devices don't work in silos. They work in a system level. And so first of all, they are designed to be durable, right? So they should be used over time because it's safe cost of replacement. And how we achieve that is that we design them to be durable, including the product itself or its material. Next. And based on that, we also ensure that these devices can be maintained. For example, I had Concepta mention that some devices in Kisumu lack spare parts. And the device, it would be a shame to make a device rendered inactive because of a spare part. And so in medical device appliances development, we ensure they are durable, but also ensure that they can be maintained over time, can be repaired, and to a certain level, upgraded. It could be a change of part or the energy system. Next. And once they are designed in those two areas, we go ahead to ensure that they can be recontextualized, because sometimes it might be obsolete in a particular area. Let's say, for example, pediatrics, and we can move it to gynecology, right? Just to save a device, use value and ensure that it remains in the economic system and use over time, especially in resource constraints area. And in some cases, the devices need to be refurbished and put back into a different sector, or to a higher degree, they can be remanufactured again and used. And the whole point is that these devices, remain used in the economic system over a long period of time. It saves cost, it saves time, and in fact, most areas don't have appliances. So why not ensure that they can remain used over a long period of time? And next slide. Well, to guarantee that the economic system is sustainable, we also ensure that they are designed to be recycled. Can we harvest parts? Can we recycle them? We see a few examples already, in context where they are designed to be, to follow all these principles. And this is our benchmark or our framework of how we develop medical devices, be it a device itself or its energy usage. It should be long use, extended use, can be recovered, and to a certain level can be recycled. And I'll show you a few examples in the next slide of how we've gone about this to ensure it is done in a way that it can have energy access and what factors we consider in this case. So for example, take the first device, the electrosurgical device. So in most cases, to carry out the surgery, you need such a device. But because it is bulky, it is expensive, and requires high energy inputs, patients don't receive such surgery, right? And so we thought, how do we rethink the whole system? Right? And we look at the factors of the context. Is it power available in many instances? And we're looking at remote areas in this case, right? In urban areas, we can have, some sort of, solar system grid, connection. But as you go further in remote areas, access to power is unreliable. And so we ask ourselves, how do we rethink that device so that it fits energy systems, but also provide affordable healthcare? And this meant that the device had to include a power stabilizer, AC-DC converter, and a backup battery. Because if you go more inland, then the device should be able to function and provide care where it's mostly needed, where it's in these remote areas that are densely populated in most cases. And so in looking at energy efficiency of devices, it has to be also captured already in the device design. Medical devices in Africa are not designed in Africa or for Africa in most cases, or Global South. They are designed for high-income countries, which have stable power, stable repair facilities. And so when we buy them from these high-income countries and place them in most cases in African settings, they have different factors of context. And so would a device that is designed to operate in France operate the same way in northern Nigeria? And the answer is no, because in France, perhaps they have access to, reliable power sources that can, run the device for hours nonstop. But that device is either bought with the same intention or donated and placed in northern Nigeria, for example, where it has weak power grids, no reliable power supply, and therefore the device becomes obsolete because of lack of that factor of accessible and available energy supply. And so you spend 5 million euros or dollars to buy a high-end device, and then you place it in context in Africa, and then on arrival, it's rendered obsolete, right? And these factors need to be considered from the start. As we procure devices or design them, we need to think with in what context would this device work? And in example number 2, this is Vaxibox. They have a first model, which is quite big. And they said, Carl, could you help us redesign the device to fit, to be energy efficient, but also portable to access remote areas? And so we rethink the whole structure from its battery lifespan to, can the battery be replaced in those areas? Can they be charged, with grid power or solar? And all these factors add into how you then develop a medical device to function in the context of resource constraint settings. Most often, we overlook those factors. We procure and install, and on arrival, they're obsolete. And if you walk in most healthcare centers in Africa, you see a pile of medical devices, on the corridors or outside. Those devices actually still work, but due to some factors like spare parts, lack of energy sources, they are rendered obsolete. And so in talking about energy access, we need to go back to the drawing board. As we design devices, we should consider all these factors: energy, spare parts, availability of energy sources. Which sources? Is it generator? Is it off-grid? Is it grid power? Is it solar systems? They have to be considered at the very front end of either procurement or design of medical devices. And our framework helps us analyze all these factors as we innovate on medical devices for this context. And number 3 is an easy tower for laparoscopy and uroscopy. These are very simple, operations in medicine. But then, if you buy those devices off the shelf from, let's say, big corporations, they are bulky, they require excessive energy inputs that placed in most regions will not function out of a typical EU, Southeast Asia, or America, right? So how do we rethink the whole structure? There we have a device that can provide its care, but has the input for energy that is reliable in that context. So you see, for example, here we worked in Nepal where we shrink, a laparoscopy device for ENT as well, that its power source is inbuilt in the device and can be changed by battery power. So you can actually know how much energy is left and what time, and you can change it even between surgeries, right? And all these factors are considered at the front end of medical device innovation, which is often overlooked when doing procurement or donations. And so we are trying to, as a laboratory in TU Delft here, rethink how we design a medical device, but also how we advise corporations on what they should be looking at when they're trying to procure medical devices for resource constrained settings. For example, take Gaza, right? What kind of device will you buy for Gaza? Considering that it's a war zone, because they do need medical devices. But you can just airdrop a device from Spain into Gaza and expect it to work the same way. No, they have different factors to consider based on their context, right? And so part of my work is to help corporations rethink the whole systems. If you want to supply solar systems, for how long? How would they repair it? How would it align with the medical device itself and the healthcare system? And all those factors must be looked at to ensure that you have a balance of inputs to guarantee sustained use of medical devices or its energy input. And often I repeat is that most corporations overlook this and go, let's install, energy sources, or let's buy devices, ecosystems. You don't compare these factors. And we try to stimulate that. You should actually consider, and there are very many factors, very many to consider. And on top of it is the device use and energy source. Those are key ones that we look often. The last one, it's a device where, due to the lack of energy sources, for example, to power autoclaves, we rethink the entire device itself. So in most cases in Africa, an autoclave has to be full with devices for it to run, but it takes days to get it filled. And so a device is also on hold for a long time because you're waiting for the autoclave to get full so you can run it. And in that aspect, lives are lost because the device is not available or in large numbers, but also then they are not cleaned often. So there's a long waiting time for device reuse. Based on those factors, how do we rethink the device itself so we can create more space for other functional devices that actually have to go into an autoclave to be used, while others can be cleaned with chemicals? But based on these factors, you consider trade-offs, balance them off, and then either redesign or propose new ways on how you could use the device or reprocess them based on energy factors. And based on talks with different corporations, I have to always draw them back, like measure factors. What do you achieve? Power is great, but is it enough power to function to get a hospital? Maybe not. How would the hospital maintain these power sources over time? 10 years, 5 years? Is it possible? And if not, how do you rethink it that it is modular where they can have incremental growth stages? But without these factors being considered, we do touch and go points where we install, leave, come back after 6 months, it's obsolete, right? And I've seen very many even solar farms, in Africa where you spend thousands of euros and you install these systems and they don't even have access to repair of those systems in place, which renders the whole concept obsolete, right? And so we propose, part of my lab, that before we install the devices or system, you have to look at the contextual factor. Next slide. And based on these factors, next slide, you have trade-offs, complex relationships, and sometimes even moral compromise. For example, a device can be durable, but requires high power and hence expensive, right? Or it can be affordable, requires low power, but has to be used in batches. So how do you balance all these factors? There is no wrong answer, right answer. You have to bring together all the factors in one area and then begin to see how do we balance the trade-offs. And sometimes they might have very complex relationships. But avoiding this means that you are blinded on an aspect that in the future might lead you to greater demise, right? And so we always say in medical device innovation, whether it's healthcare systems as well, we look at complex trade-offs. What works to what degree? It's not perfect, but if we add these layers to it, how do we balance off that it provides sustainable healthcare over a long time? Because people do die a lot. I've watched patients, lost life because there is no access to power for 5 minutes, or a device is missing. A device as simple as a syringe is missing, right? And so all these factors have to be looked at on a macro level, balance, not perfect, but have some sort of moral or technical compromise that still guarantees an efficient and sustained use of medical devices to provide healthcare for those who need it more. And last slide. I'll conclude. Next slide. Next slide. The slide before that, sorry. Next slide.
Sorry.
There we go. Yeah. And so I would say, whether it is energy access, stakeholders, medical device companies, we need to continually assess contextual factors. It is done in the US, it is done in Europe, it is done in Asia. We can't just drop ship, different aspects of innovations in resource constraints. We need to really be intentional in that we look at what factors are critical, we weigh them out to be able to deliver suitable healthcare over time, not over 6 months, over 5 years, over 10 years, over 20 years. It may require us to change our approach of thinking. We need to relook how we invest in innovation or in solar system. We may require us to look at how we do procurement or donations. All those things have to be reconsidered in every aspect to propose a sustained solution. And last slide now, last slide for real, yeah, is that, no, not this one, before this, sorry, next slide.
There's nothing else.
No, the slide before this.
Carl,
yeah, there we go,
yes.
yeah. This is the
I
whole
would like
point.
to ask you to wrap it up, because
Yeah.
Mr. Justice also waiting for his
This
presentation.
This is the last slide, sorry. This is where we're going to avoid. Currently in Africa, on most places, you'll find this. These are functional medical devices that are kept obsolete on arrival in most cases, because we did not contrast or look at what are the factors that we need to even accept donations or install new devices. And we can avoid this to a higher degree by considering all these contextual factors before we actually implement medical innovation, be it the device itself, energy sources, or healthcare systems. Thank you.
Great. Thank you so much for that really wonderful look at that research and your experience in the space. We really appreciate it. I'd like to now pass it over to Justice, please. And Justice is the founder and executive director of Spectrum Africa Climate Health Initiative. Justice, over to you. Thank you.
Thank you, Sienna. I hope I'm loud and clear. Sure, thanks. I agree with Dr. Samenjo when he mentioned about trade-offs, because that's the language I keep using. Let's go for trade-off. So my name is Justice Ogando. I serve at Spectrum, and my interaction with the Energy Caucus in this call was through Emily. I had an interaction with Emily early last year, and she was doing this research. I think it had just started. And she mentioned something that stuck with me. She told me most of the equipment in this country are imported, and they were not built for a stable grid. And that piqued my interest. And I shared with her what I was doing on value chain optimization, and she was also interested. So along the way, we've been exchanging a lot of notes, but I took a path of learning. I just wanted to understand how can we craft a solution that can help sort out health electrification in Kenya. And that is how Empower was birthed. An idea that took close to 10 months to develop. And I was able to reach out to an organization in the US to help me build it up. And so it's an internet of energy. A bit of my background, though I know I have 10 minutes. I'm trained in CPA and BCom, but I've never practiced. I've had a squiggly path into global health, and that is where I faced market shaping interventions that led me into the climate health space, because nascent spaces like climate change tend to suffer distortion in market, and that's why we're having these kind of challenges that are existing. And so with that, I was able to craft a pathway around sustainability. And Empower, basically efficient management of power, is an internet of energy, more of a context-aware digital twin. And the way we came up with this is I looked at the situation that, next slide, please. I looked at the situation that Emily was trying to address, and I thought to myself, if you could just go back to the other slide. Yeah, that one. I looked at the situation Emily was addressing, and I asked myself, how long will it take to fix all the devices in this country when the grid is unstable? And in one of the assessments, vulnerability and adaptation assessment exercise we were doing, I think last year, I visited a sub-county referral hospital, a level 4 operating at a level 5, because the patient load it's handling, 50% are referrals. So it has a very large catchment area. So that already shows you that care is not available at lower level facilities. So middle to higher level facilities are getting loaded with patients. And when I looked at their energy supply sources layered on top of the main grid from Kenya Power, were these 2 generators and 20 solar panels, 21 solar panels. And there's the old generator, 250 kilovolts, which generates a 200 kilowatt per hour rating energy, was supplying and running the entire hospital, the mortuary, the biomedical engineering, 247 bed ward, radiology. They also have an oxygen plant that is freezing most of the time, dental unit, and admin. And they got another donation of the same rating of generator that only serves a new building, basically computers and outpatient. And I asked them, how are you utilizing this power from the new generator? And it looked clueless. So the network was not optimized. And then I found the 20 solar panels that I used to harvest borehole water. And when I asked them, how long do you take to fill these water tanks? And they said 2 hours. And how do you use them? And the usage shows that the pump, the solar system works for 2 hours per day. In a country straddling the equator, where we have full day of sunlight, solar panels were only effectively used for 2 hours per day. And then they have another one for reverse osmosis. And that's when I started asking questions around optimization of the network. Is there a way we can secure the energy assets and the infrastructure? And I found that we were dealing with a contested environment, an environment that suffers both physical and signal-based threats. Voltage fluctuation is there, the switch to generator and consumption of diesel that also is a greenhouse gas emitter. And I realized that the decision latency was the difference between uptime and system failure. These guys were not able to manage that. That's how we designed Empower. Next slide, please. And so Empower basically is a digitization layered between the supply sources of energy and the usage environment. I've added the layer of storage because I think as we go into health electrification for health facilities, we really need to think deeply about storage. There's a lot of power being wasted in an environment that is unstable, and it's also costly. And so we looked at Empower as a digitization for the energy infrastructure and assets. More than modernizing, we are looking at something that is more predictive. So think about it this way. When you have a grid voltage fluctuation, instead of it waiting for a human operator to respond, Empower as a digital twin detects the anomaly, and then it simulates the projected downstream impact. And then it reroutes power loads autonomously between the various sources. And then simultaneously, an AI agent trained within that twin environment identifies the irregular signal behavior consistent with the reconnaissance malware. And it isolates that node, checks adjacent systems for breach propagation, and then it reports that incident not after the failure, but during the attempt, because we want to secure the grid. I noticed that most of the medical devices are failing because of that lack of building before the breach. So what we are doing with Empower is we are building before the breach, more of a preventive, preemptive infrastructure defense mechanism. And so that is what I shared then with, I struggled to get an AI coder in this country. Took me almost 5 months. That's when I reached out to these guys in the US, and they told me, oh yeah, doable. And they have done something mega for a municipal state in Minnesota. And that's how we were able to code this. So we are at a stage where we want to now pilot it. If you could go to the next slide. Yeah, we are at a stage where we want to pilot it, but we're looking at the impact of using a digital twin AI agent in health facility electrification. We can secure our infrastructure from this fluctuation and all these variations in voltage. We can actually improve uptime and care services, and also cut down costs significantly while minimizing energy waste. With this solution, we want to get to a stage where we can quantify unusable energy that would be worth storing, so that we can be able to stabilize the grid and build the investment case for health facilities to be sustainable. One of the things you'll have noticed from that site visit where we have two generators and the panels is that even CSR activities are not following the path of sustainability. So we need to match CSR with sustainability in our agenda around health facility electrification. And we need to also stop the obsession with check boxes for data. I think we have spreadsheets of data that are that are actually outdated more than the systems they purport to monitor. So if we could shift from the dashboards into a living and learning model, Then we have digital twin as a command and control layer. That way we are able to predict cascade pathways of failure and shield our equipment from destruction of this voltage fluctuation. And then we can also look at how Empower as a digitization platform is a foundation for defense imperative in a contested environment. Like I've told you, cyber threat, signal threat, physical threat, we are able to now preempt that action. And we are building this for agility, because with Empower, we're able to look at cross-domain interdependencies. Most systems we have now are not built for cross-domain interdependencies. It's more siloed, isolated, and it's difficult. You have to have human intervention. You have to schedule maintenance. Then you disrupt services while you're doing maintenance. So there's a whole host of systemic issues. And this is where I'm coming from with the argument around value chain optimization. So we came from value chain optimization in health, supply chain. Now we are doing value chain optimization of energy. Last slide, please. Yeah, we could skip this for now. It's just about the partnership. We have a joint IP on this, and we have been collaborating for 2 years. So we want to do a pilot, and we are targeting to do it in the next 2 months, the month of November, starting November, with one of the level 6 private hospitals that has offered to be part of this. We are mobilizing resources. We hope we can run this for the first 3 months. I also sit on the National Working Group on Climate Change and Health Strategy, as well as the forum that is developing the Kenya Green Health Guidelines. We are hoping to use this evidence as a use case to shape the Kenya Green Health Guidelines, so that we can then trigger from that policy action, build the case for application in public sector, targeting to do one each for the national referral, county referral, sub-county hospital, and a health level 3 health center, where we have had different systems implemented for energy supply, like solar and generate and the likes. So that's the end of my presentation. I'm hoping I'm actually within the 10 minutes you gave me. Thanks, and back to you, Sienna.
Great. Thank you so much. That was very interesting and exciting to hear about your upcoming pilot. Well, I know we only have a few minutes left, and so I want to give, anybody in the audience, I know we've had some questions come into the chat. Please, if you have any other questions, please write them in the chat now. And I'll also kick us off with one question, I think, to start with for both Justice and Karl-Heinz. And please, be mindful of time, so please try and keep your answer brief. Beyond what you're working on with your own organizations, what sector or trend are you most excited about? Where do you see the most potential for addressing these issues? And Justice, I'll hand it to you first for that.
Sorry, you caught me unawares. Can you just repeat the question?
Of course. I was saying we talked about a lot of really key critical issues today in the sector, and I'm curious what, trend or innovation are you most excited about? Do you see that has the most potential beyond what you're working on?
Yeah, so I think for me, I come from an angle of market shaping, using innovation and circular economy principles in market shaping. And I find that if we can, because energy is one of the biggest emitters, actually, the biggest emitter of greenhouse gases, but then it also holds the levers for mitigation outcomes for health sector. So I find that I'm concentrating more on energy, because health sector in itself is not presented in a sexy manner, if I could use that word loosely. It's not presented in a sexy manner in the context of climate change. It's like a beggar for help and support. And so I'm trying to bring both health and energy together to be able to do a market shaping intervention. And what I want to say is, probably we need to look at how we can create incentivization around shaping this market, because there are many opportunities that have come up that we could leverage in trying to drive this market, like the Article 6 of the Paris Agreement that gives us the opportunity to participate in the renewable energy credits and carbon credits. We could use those incentives to grow the health electrification sector, so that people can see there's incentive to invest in such kind of systems. So for me, I'm driving both sectors together, energy and electricity and health.
Thank you so much, Justice. Over to you, Karl-Heinz, please, for any thoughts you have.
Yeah, so beyond my scope of work, I'm beginning to appreciate the use of AI and quantum computing to ensure we can predict energy usage in devices or systems. And I think as a lab as well, when you rethink how do we incorporate, AI in medical devices that can either predict or regulate, energy, consumption as well. And from a point of not just a system level, but device level as well, where a device then it's not having energy wastage, but then it can be, consumed, but also contained to be used in the future. And I think where we are looking at AI trends in healthcare, but also quantum computing that allows us to power, fast use of energy within just time sprints. Yeah.
Great. Thank you so much for that. I'd like to now pass a question over into, well, first, if there's any other additional questions from the chat. I know we have one question about data on appliances that were actually in use versus stored and idle, and I think that's for Concepta and Emily to think about if they have that data and respond over the chat. I am curious though, for anyone from Concepta, Emily, or other two speakers, I'm curious, we heard a lot of great ideas today. What immediate next steps should donors focus on to improve their donation practices or to make a bigger impact in the sector overall? Does anybody want to take a first stab at answering that?
Maybe I could respond to that very fast. The most important thing is to bring all the people who are in these in one round table. For example, now that powering healthcare actually is a nexus issue, so we need to have an energy person and a health person whenever we are talking about procurement of these devices, so that when we are receiving even donations as a country or even as a resource constrained area, we know what will work for us rather than just receiving them. And then we get opinion from even the healthcare workers who are going to use these resources. So the first thing is bringing all these people together in one room. Yeah. Thank you.
Thank you so much, Concepta, for that. And I see we have a question from Joan. So I think first thing for Concepta, was there a difference between private and public sector purchasing decisions? I'm not sure if you were able to look at that in your research, but I'm curious for Emily and Concepta if you saw any differences between public and private purchasing when you visited the different facilities.
If I can answer that, our study was not focused on private hospitals. We majorly focused on public, and so we were not keen to compare whether there were any purchasing differences. But what I know, most of the appliances in public facilities are either donated or distributed from the central government based on request, and so it cannot be easy to say with certainty that we compared the purchasing decision from these two kinds of facilities. Yes, thank you.
Thank you, Emily. Caroline, we also have a question for you. Joan says that she's curious about the role of research in supporting disposable equipment to maintain a circular economy. Do you want to respond to that?
Come again?
In the chat, we have a question from Joan. She says she's curious about the role of research in supporting disposal of equipment to maintain a circular economy.
So first of all, research is very key in any aspect of innovation, right? Because it helps us understand what we need to know to innovate. So I believe in research, and I think it's very critical and must be done to understand key fundamental aspects for innovation. The second point, disposable does not support circular economy. It's opposite. Disposables encourage, the lack of circular economy. And so circular economy aims to ensure that we don't dispose. We conserve products and services over time to be used over a long period of times, right? And so disposables, actually, we try to reduce disposables in circular economy, right? Because you have materials are lost and products are lost as well. Even energy to produce the device is lost as well. And so in circular economy, we ensure that devices are kept as long as possible in the economic system and reuse over time. And that calls for different ways of use of instruments or design of them. But I think disposables, we should perhaps begin to walk away from those in the near future.
Great. Thank you so much for that. I really appreciate that. I think, Joan had one follow-up question or clarification there, so you can see it in the chat as well. My question is whether you have solutions for disposable of the equipment at end of life, because this is a gap in old hospitals.
Yeah, that is a key research question that I think the world's answer. And we have a very big department here that focuses on how to redesign, for disposable equipment, and how do you even collect them and process them. It requires much to be done in terms of materials we choose to produce with, plastics that are pain. And I see different options coming up. For example, now we have metallic, devices that can be, clean and reused over time. That calls for change of systems that can actually ensure they are reprocessed, because then to clean devices, you need to hire someone or new machinery that can then do that. And that requires extra process or extra resources to hire someone for that role. And so there are still tensions among this role, but we all agree that we should begin to work towards how do we limit disposables, because materials are finite in the economic system, right? We don't have forever aluminum in the soil, right? And so we all agree as a globe that we need to rethink how we use resources. And I think I see very many initiatives being done to address that. And that's a key part of my research as well, is to focus on how do we have an end-to-end, circular economy of medical devices. Yeah.
Wonderful. Great. Well, I know that we're over time. I do have a few more questions. Obviously, people can drop off as they wish, but I also want to give one, final look at the Q&A section of the chat. I know we have a question from John. Any consideration of disposable equipment to promote circular economy, which I think we did talk a bit about before, but John's second question, and I think that this can really be relevant to any folks, but I'd love to hear more from Emily and Concepta based on their research. Second question is, how can power quality affect the lifespan of medical equipment? Emily or Concepta, any thoughts from your research?
Power quality, depending on whether it's of low quality or good quality, can affect the lifespan, either by prolonging or reducing the lifespan. So for our case, maybe in Kisumu, where we have unreliable power, this mostly affects appliances. From our visit, especially depending on the voltage of this or the wattage of these appliances, power fluctuation might interfere. And from our study in Kisumu, the main appliances that were culprits to this power instability or unreliable power were the autoclaves. And so we found a number of autoclaves that either had their coil burned or the plugs not functioning because they could not, there was no surge protector to cushion these appliances from the frequent and reliable power. So depending on the quality or the intensity of power, this could really affect or even lower the lifespan of these appliances. Thank you.
Hey, Justice, did you want to go ahead?
Yeah, I wanted to back it up by saying we have a scenario of an autoclave that was donated by one of the European countries that requires all other services and equipment to be shut down for it to run. And that's a kind of scenario we have to deal with. That donations need to be contextualized, because when you have a machine that requires the whole hospital to be shut down in terms of power supply to run one machine, then that is danger to care service.
Wonderful. Thank you so much for adding on to that. Well, I know that we are 5 minutes over now, so I think we'll probably wrap up with that. I don't know if any of our panelists have any additional thoughts that they were not able to share, any questions that were asked that they actually wanted to respond to as well. I want to give each of you a brief moment for any closing things before we wrap up here.
Well, just to wrap up for me, these talks are endless and they require more time. And so please feel free to reach out to us at convenience, and we can continue discussion after the webinar. I would love to have these talks where anyone have interest in how they can redesign the appliances or systems to fit these settings. Thank you.
mine is to encourage the different sectoral alliances to get together. I think on the health side, we have the Climate Health Africa Network for Collaboration and Engagement that does a lot of research dissemination, and we are in the space of science, policy, and practice. So I think if we could bring in, we could create a bridge where the Energy Forum can connect with such networks. It can also help augment the work that is going on in this climate formation. I've noticed that they are disconnected from what's going on in the energy sector, much as I was also surprised that there's a whole energy environment I was not a part of. Thank you.
Great, thank you both so much. And I know, Sam, you had a question in the chat, so maybe our panelists can respond to you over email or in the chat while I close up here. I just wanted to say thank you so much, everyone, again, for your time, for your insights. Thank you to our panelists for sharing their very important work with us. And thank you to everyone for, putting great questions in the chat and for your engagement throughout. And we'll be sharing these slides. And as we mentioned, and as our panelists just reaffirmed now, please feel free to reach out with any additional questions, comments, feedback. We're all very keen to make sure that this research continues to be useful and that we continue these discussions. So thank you so much again for joining today.